confidence in medical scientists and the CDC has declined since COVID. Could that have been avoided?
Well, I have to say, first of all, that there has been a lot of misinformation, disinformation, and there are people who perpetuated that. And it's not from reputable scientists and public health officials. But at the same time, I also think that the public health establishment has made some unforced errors, including, for example, not acknowledging as much as we should have that science evolves. And when science changes and new data come out, our recommendations also have to change. I think the CDC could have done a better job of explaining the rationale behind their changes. And I also think that we shouldn't have been so quick to dismiss certain hypotheses that actually turn out to be valid. For example, natural immunity is actually a thing. But I think that there was fear initially that if we talked about natural immunity, it might dissuade people from getting vaccinated. But actually, in not being truthful, although it was for good reason, it was to try to get people vaccinated, still, I think that ended up breeding distrust because people thought, if you're not being honest with me about this one thing, why should I trust you on others?
You know I love to respond to social media in real time. I'm ill-equipped on whatever might come in on COVID, and I've got the expert in you. So, Catherine, give me something, and I can involve Dr. Wen in responding to it. What do we have? Okay, we need to embrace where the experts got it wrong. Our children were never at risk compared to elderly or those with preconditions. A one-size-fits-all approach did serious, irreparable harm. Again, experts need to embrace this, not deny and defend. That's not necessarily directed at you, but what thought do you have about that?
I think the issue is that we keep on saying follow the science. And of course, I agree with following science and being evidence-based in our decisions. The problem, though, is that science alone is usually not going to give us the answers. For example, even if we knew at the very beginning that school closures would result in this much harm in children, but also initially, especially before we reach such levels of high immunity from vaccination and infection, before it is true that closing schools probably reduced the level of transmission and may have saved lives. But if you have those same data, different people are going to come to different conclusions. And I actually think that so much of what's gone wrong in people's trust of public health officials is that we keep on saying follow the science as if there's one right answer. There isn't. It's all about trade-offs. Public health is extremely complex. It's really nuanced. And the more we can lean into that nuance and talk about trade-offs, the more we're able to convey the actually how complicated this whole situation is.